Hello, I'm here today with Dr. Cheryl King, professor in the Departments of Psychology and Psychiatry at the University of Michigan and the director of the Institute for Human Adjustment. Dr. King, thank you very much for being with us here today and answering our questions.
Thank you for the invitation. I'm pleased to be here.
So today, Dr. King will be talking to us about suicide risk and assessment formulation for children and adolescents. So the first question I have is, if a parent or a caretaker is concerned about their child's behaviors and feelings, how will they find out if their child is at risk for suicidal behavior?
Well, I think first and most importantly is the parent should trust their sense that they have a concern and go with that concern and get a professional evaluation. So parents, the more they can have an understanding of what might be red flags for increased risk. For instance, they see several signs of depression, like their child is no longer wanting to do what they used to do. They're no longer getting pleasure from being with friends, being on a team, hanging out, being on the phone, being on the computer. They're seeming very down and discouraged, or they're showing behaviors that are a concern, substance abuse, declining school grades. They're sharing thoughts that they're hopeless. There are many signs of possibly increased risk that parents could become familiar with. And then they also just have a sense that something has changed. I'm concerned about my child. When they get this concern, I think it's important to take the child for a professional evaluation to get a full risk assessment, but also to share that concern with the child. So the child is not surprised and wondering why they're going for an appointment, and the child has a chance to talk with the parent and get some support. So a parent might say, for instance, I'm concerned about you. I'm concerned about you because I've noticed this, or that you no longer seem to be enjoying something you used to like so much. I'm wondering, what's going on, and I'm wondering if you might have had any thoughts of hurting yourself. Could come out as part of that conversation once it begins.
So which methods for suicide prevention for children and adolescents have good scientific support?
I think one of our challenges in the area of working with youth suicide risk and suicidal behavior is that we have fairly limited evidence at this point in time. I think our clinical science is just catching up to what our needs are for working with suicidal youth. However, there are some promising treatments out there. We have good data from adult studies, including young adults. And in many ways, our adolescents and young adults, the risk factors are very similar and largely the same. We have evidence that a cognitive behavioral therapy approach that focuses on maladaptive, negative cognitions, maladaptive behaviors, focuses on engaging youth in more positive behaviors and activities. A dialectical behavior therapy approach that focuses on emotion regulation too, that there are these approaches that with adults, including young adults, have been effective in reducing the likelihood of suicidal behavior. We also have studies showing that just emerging, that if you work with depressed teens who are also abusing alcohol or substances and use a child and family cognitive behavioral approach that's quite intensive, that the data is looking promising. So I think the more active approaches that are building new skills in problem solving, in emotion regulation, in coping, and improving communication with the family are quite promising.
Now, are there any types of prevention strategies or treatments that don't have as good scientific support?
Again, because there have not been a lot of studies where we have done comparative efficacy or comparative effectiveness trials to pit two treatments against each other, we don't have that kind of data to say that a particular approach is harmful or a particular approach is definitely superior to another one. However, because the emerging evidence is pointing in the direction of interventions that are building new skills, new ways of thinking, perhaps more behavioral activation, better emotion regulation, better problem solving, it is possible that an approach that is solely supportive, no matter how frequent that therapy is over what period of time, it may not be as effective because it may not help the teen build new skill sets.
So how can this problem affect children or adolescents as they get older?
Well, I think because the group of youth who are suicidal is so highly variable that it'll affect each one of them in different ways. But looking across the board, one thing that may be important for parents to know that is adolescence is the time during the lifespan when we see the most suicidal ideation and when we see the most suicidal behavior. And during even young adulthood, and certainly the middle-age years and older adult years, we don't get as many reports of suicidal thoughts, nor do people engage as many suicide attempts. So there's a developmental period where, and it may be a period where there's more questioning about life, about meaning, about where I'm going. It may be because there are also less life experience to put some bad things that happen into context, or poor problem-solving skills. Maybe it's the beginning use of alcohol that becomes much more available and heavily used in the adolescent years. Whatever the reasons are, it's a higher prevalence. What that means is that some of those youth actually never engage in that again later in their life. They do not have a lifelong pattern of suicidal behavior and suicide risk. There are some who have chronic mental health disorders, such as a severe depression or severe bipolar disorder, where they may deal with this on and off or chronically through their life. So we have different groups.
And some parents may wonder, what caused my child to, think about suicide? So what would you say to a parent or a caretaker who's wondering about the cause?
I think that is the most natural thing in the world as a parent. When our child is distressed in some way or has a problem, we want to get help for them, but we're also left wondering why. Why is this happening? How can this be happening to my child? And I think that sometimes we never know for sure, but we can point to some of the things that are very distressing for children. Is this child struggling with depression and they're not sleeping well, they're feeling miserable, they're tired, they're sad. Over time, that will take its toll, and we often see suicidal thoughts during the course of a depression. Is the child struggling interpersonally with a great deal of conflict, problems at school, alcohol, substance abuse? They're no longer attending, they start to have failure experiences, and people are angry or disconnected from them. Maybe they even have become a bully and have become estranged in some way. Is the youth a victim of bullying? So there are many different pathways to getting to a point where there's a lot of emotional distress and pain, and a young person might begin to have suicidal thoughts.
Is there any other important information that you think parents should know about suicidal behavior in youth?
I think that it is useful for parents to become familiar with some of the risks and the red flags, and that information is very readily available online. And there are a few good resources. One that I want to suggest now is the Suicide Prevention Resource Center, because this is federally funded in the United States and available to all of us, and it's sprc.org. SPRC for Suicide Prevention Resource Center. They have a lot of information where parents could be familiar, and sometimes it's helpful to know what those red flags or signs of possible risk are if you're concerned. I also think for parents that it is important to consider if they think their youth may be at risk, that they might want to monitor that youth more carefully. They might want to know what are the crisis numbers available in their area. Where would they get help? There is a 1-800 number that I have here and can share. It's 1-800-273-TALK, 8255, and I think that's useful to know. But a couple of other ideas for parents. One is to support the youth getting professional treatment, to try not to give a mixed message, to not say, come on, you know, you're doing so well at school, we have such a great family, snap out of it, pull yourself up, it'll be okay. But to hear that the youth is in distress and may benefit from help, to get them that help, and then participate in it as needed. So I think knowing some of the signs, knowing where to get help, supporting getting treatment, and supporting getting good treatment. If it isn't going well, to go somewhere else, and then participating in that are particularly important.
Well, thank you very much.
Thank you.